Hello, my name's Hannah. I'm going to be performing my NG tube insertion skill. First, I'm going to start by checking my healthcare provider's orders, and I'm also going to make sure that I have all my necessary gathering equipment. So I have my NG tube, I have my 60 ml syringe, I have my pin light, my stethoscope, my water-soluble lube, I have tape, I have gloves, I have an emesis basin, a towel or an absorbent pad, a suction adapter if necessary. I have tissues, I have a cup of water, so my patient can take small sips, and I have a pH test strip to test the gastric contents. Now I'm going to go ahead and perform hand hygiene here and grab some clean gloves. I'm going to go ahead and pull my patient's curtain closed for privacy. Hi sir, my name's Hannah. I'm going to be your nurse today. I'm going to go ahead and check your wristband here. So can you tell me your full name? Okay, and can you tell me your date of birth? All right. So your doctor has ordered a nasogastric tube insertion. So what we're going to do is we're just going to go ahead and insert a tube through one of your nostrils. It's going to go down through your throat and all the way down into your stomach. So once I have explained to my patient the procedure we're going to be doing, I'm going to go ahead and place them in high Fowler's position if tolerated. And I'm going to bring the bed up to a safe height for the nurse and the patient. Once I have done all that, I'm going to go ahead and assess my patient's nares. So I'm going to be looking for any abrasions or irritations, redness, swelling, maybe any bleeding. I'm just looking for anything of that nature. I'm also going to use my pin light to go ahead and look inside, also looking for any of those things, abrasions, contusions, irritations, redness, any bleeding, swelling, anything like that. Sir, I'm going to go ahead and have you hyperextend your head, and I'm just going to go ahead and look into your nares here. Alright, so I don't see any of those things. Alright, so the nares do look good. Now I'm going to go ahead and have my patient obstruct airflow in one nostril and breathe, and do the same in the other nostril and breathe through their nose. And I'm looking to see which side of the nose has better airflow because that's the one that I want to insert my NG tube in. So I'm just going to go ahead and help my patient here. So go ahead and breathe through your nostril. Okay. And breathe through your nostril. Okay. So for this skill, I'm going to go ahead and use my patient's right nostril because it does seem like it has the better airflow. And now I'm going to go ahead and prepare my tube. And if I was using a large bore NG tube, I would want to make sure that it's in an emesis basin, or not emesis basin, a basin of warm water while I prepare the patient. So now I'm going to go ahead and grab my NG tube, and we're going to determine how far I'll be inserting this by measuring from my patient's tip of the nose to the earlobe and down to the xiphoid process. So because this tube does have actual markings and measurements, we're going to be going down to the 45 here, so I won't need to tape it. And now I'm going to go ahead and put a towel across my patient's chest, and we're going to go ahead and lubricate the tip of our NG tube here. We want to make sure that it's well lubricated to just help with comfort and ease of insertion here. So once we have our well lubricated NG tube, we're going to go ahead and insert the tube with the natural curve here. I'll have my patient hyperextend the neck, and we'll just gently insert it here. I'm going to direct the tube along the nostril floor towards the same side of the ear. I'm also going to make sure that if I feel any resistance, I just withdraw the tube and we'll use the other nostril. And once I feel like I have reached the oropharynx, I'm going to go ahead and more than likely my patient will feel it or gag. So we'll go ahead and pause for a moment, and we'll go ahead and let our patient take some sips of water, and hopefully that will ease the gag reflex. So once that has calmed down, I'm going to just instruct my patient to take sips of water. And with every sip of water, we're going to go ahead and insert this another 2 to 4 inches until we get to the 45. I'm going to go ahead and have my patient just tilt their head forward, and I'm encouraging them to take small sips of water while inserting the tube 2 to 4 inches until we reach 45. So once we've reached 45, I'm going to go ahead and verify my tube placement based on facility protocol. So I can go ahead and check it by using a chest x-ray. For this skill, I'm going to go ahead and aspirate stomach contents, and we're going to check it with a pH test strip. So we'll go ahead and check that. I'm also going to go ahead and pull this. I'm going to inject 20 milliliters of air into this, and I'm going to listen over the epigastric region, and I'm hoping to hear a whooshing sound to help me verify placement. So we're going to go ahead and inject the air. All right. So I did, in fact, hear the whooshing sound. So at this time, I'm going to go ahead and secure my tube with tape. I'm going to tape it over the bridge of the nose here, just to secure it there. And once we have that, we're going to go ahead and either attach this to a feeding apparatus. We will go ahead and clamp it off, or suction apparatus as well. It just depends on the healthcare provider's orders. So once we have that, I'm going to go ahead and secure this to my patient's gown using the safety pin or the elastic band. I'm going to go ahead and bring my patient's bed back down to the low position. I'm going to remove my gloves and perform hand hygiene. And once I've done that, I'm also going to go ahead and establish a plan of daily NG care. So if my patient's attached to suction, we're going to go ahead and make sure that checking for patency of the suction in the NG tube care plan. I'm also going to make sure that we're documenting any type of drainage, like any characteristics like color, odor, amount, anything like that. And once we've done that, I'm going to go ahead and lower my patient's bed down. I'm going to give them their call light, and I will also again perform hand hygiene on my way out. And now I'm going to go ahead and document this procedure. We'll go ahead and document the care, the assessment, and we will also document how well our patient tolerated this, and they did tolerate it very well.